Hi, Steve Adler. Good evening. Got a minute? All right, we're going to go over the virus numbers tonight just so that we can see those. We have Dr. Escott giving his report to the City Council tomorrow, so we'll have his charts tomorrow. But let's talk about some of the things that he's seeing. We're not going to be long tonight. Let's begin with the first chart. We look at the admissions. Now, admissions down to 11. Now, recall that we were trying to get admissions down to 10. They were slowly working their way up. We got up to 22, 23 on the 7-day moving average. Right now, the 7-day moving average is 21, but we came in with 11 on new admissions. The numbers just seem to be moving around. Look at that graph off to the right. It's hard to extrapolate from any one day where we are. But this is happening in the backdrop of El Paso right now that had 1,200 new cases. Smaller city than us with over 10 times as many cases. Hospitals so overwhelmed they're taking a look at taking patients in El Paso, putting them on planes and sending them to other urban areas, hospitals around the state to take care of them. Dallas last week went up to the red zone in their risk level because they're seeing indications of their numbers going up. Here in Austin, we were seeing some hints of numbers going up, but also some numbers that are staying flat. So we're kind of in an ambiguous place. But of course, that both is reassuring that we're not El Paso, but keeps you nervous about where we are. But let's talk about that and get a little bit more data for us here. New cases, skip the page. New cases was 102 on that page. You can see it off to the right. The 7-day moving average is 86. So it's high, but it's still generally within that same range. Number of new cases has stayed basically kind of flat for us. If you look at the green numbers, those are the 7-day moving averages for hospitalizations, ICU, and on ventilators. What we had been seeing, of course, was that our actual numbers were up higher than our 7-day moving averages, which meant that we were increasing. Let's see what it looks like today, because we'll go to the next chart. Because what this chart shows us is there seem to be leveling off too. So the number of hospitalization, the census on any given night, 7-day moving average, 121. But you can see we have 114 people in the hospital tonight, less than the 7-day moving average. How many people do we have in the ICUs tonight? 43. 7-day moving average, 43. So it's right on top of the 7-day moving average. People on ventilators, 7-day moving average is 20. How many do we have tonight? 18 people on the 7-day, 18 people in there tonight, 20 people on the 7-day moving average, so a little below the 7-day moving average. So again, we were flattened out, kind of in the 10 to 12 range. Then we bumped up to 10 above that to get up to 21, 22. But now it looks like we're kind of leveling at that number. I'm nervous about this weekend with Halloween coming up. We have to maintain the discipline. Maybe it's that people hearing the alarm are redoubling their efforts to wear their masks and to social distance. And let's hope that that's true. Certainly masking would help us with cases, 3 to 7 days after that. I think we started sounding this kind of mini alarm probably about a week to 10 days, maybe 2 weeks ago. Total number of cases up to 31,653. And on that last chart, if you look at the number of people that have passed away, it's 449. That's the same number we've had for the last 2 days. So no new deaths over the last 2 days, which is a good thing. So let's take a look then at the university board, and I think Escott's going to talk to us about it tomorrow. I'm looking at numbers, as you are, that are kind of leveling off again. I'm trying not to get a false sense of security that we're leveling off, and just taking a look at the UT modeler would help us not have a false sense of security. This is the model. It's good through 1023. So it's not quite up to date. I would imagine they're going to update it here again. But the R number has risen to 1.45. Which is among the highest we've seen for a while. Remember, anything over 1 means the virus is increasing. Below that, it's decreasing. 145 is high. 100% chance, they say, that the virus is escalating. We've never seen 100% in that number before. And the 14-day average, 110% more infections. We used to be looking at numbers that were down in 10 and 14% increase. So what is it the model is looking at? Look at that chart. You can see that line. The green dots are our actual experience. The gray dots or the gray lines are the probabilities. The dark green line off to the right is what the model predicts as the median solution. And you can see how that increases. That's what's having everybody nervous. So we have to make sure that we're doing our behaviors, that everybody's masking. I've been walking around the streets and I see a lot of people doing that. I am concerned. We have some concerts over on the east side of town that seem to be gearing up again. I know we all want to be, close to one another again. Just a reminder, everybody just needs to be, please be careful for your family. Again, what we're seeing a lot of, it's people in the evenings, they get together with their family and their friends and they figure they don't have to do a mask because even though these people aren't in their household, they're friends. And we hate to think that our friends are going to be carrying the virus, but they may not know. And that's the viruses that we're seeing. So if they're not in your household group, show the discipline. It's something that we need to do. But we have been starting to talk about distributing the vaccine. And on Friday, the community leaders, along with Austin Public Health, got together to talk about setting up the systems for us to distribute our viruses. And what was presented to us, we'll see right now, is kind of a schedule on what it is that we may be looking at with respect to the distribution of the vaccine. And they broke it into different phases. The phases that we have are 4 phases, and this is the chart that you're seeing right now. Phase 1, they're predicting that in November, December, we may start getting the first vaccines coming in. Of course, we don't know for sure, but it could come as early as that, probably not in November at this point, but into December. And if it came in, only going to be available for those that are most critical in need. The first people we would give it to, maybe the people that are working in our intensive care units, because we can't lose them off the front line. We need them healthy and able to help people. Maybe it's older people in nursing homes that are the people that are the most susceptible and represent the largest group of people that are dying because of this virus. But we might start seeing it begin to show up that early. I personally think more likely after the first of the year, January, February, before that happens. But phase 2 then starts in January, they say, runs through July, and that's when we start seeing more and more doses. They're predicting 660 million nationwide. That's when it begins to roll out. Now, we don't know exactly what that's going to look like. We don't know if this vaccine is going to be, one and done where you get the vaccine, or whether you're going to have to come back, get the vaccine, and then come back in 30 days for a booster. Often vaccines work that way. We don't know which vaccine or vaccines are going to be the ones that are most effective. We don't know what the conditions are for delivery. Some vaccines have to be kept super, super, super cold, like dry ice cold. And if we're going to distribute those, the question is, how do you keep things that cold and still get it out in the public for people to be able to take it? But it's anticipated that between January and July, we're going to be giving out more and more of the vaccines. We're testing that process right now with delivering the flu vaccines as we begin to have conversations. And then likely into the fall next year, we have an excess supply of vaccines. No one knows for sure, but that is the general framework for the different kinds of of scenarios there are for vaccines. Best guesses at this point, and in some regards they are guesses because we haven't cleared any vaccines yet. But when we do, it's important that we've taken our time, that there's unanimity among the scientists and the doctors about their effectiveness as well as their safety. I'm going to conclude tonight. I came across another graph that I thought was a significant graph that I just wanted to share with you. You know, if you're a crime victim, even one crime is too many. But obviously, big debate in our city right now about, is crime substantially going up, screaming upwards downtown? Is crime out in the areas otherwise citywide? Is it screaming up right now? We know that generally speaking, crime across the country during the pandemic generally has been going up, but not anywhere near to the extreme that you would think if you're looking at a lot of what we see on social media. This is a chart that came from the Downtown Austin Alliance business group looking at downtown, and it just shows from September of 2019 through September of 2020 what's been happening in the city with respect to crime citywide and in the downtown area. Citywide is the yellow line. You can see kind of up and down and up and down. The dotted yellow line is kind of the mean line, flattens out the line, and you can see the crime citywide has been going up a little bit, but not an exaggerated upward line, and consistent with the kinds of things that most all the country is seeing. I think it's interesting to look at downtown crime. You can see the red line, up and down, but the dotted red line shows you median. And what we see is that over the last year, crime downtown has actually been going down. You wouldn't know that by looking at social media. And I will hasten to say again that if you're a victim of crime, any instance of crime is too many. Fighting crime and working on public safety, the number one priority of city government. We're going to be doing everything we can to help ensure that Austin remains the safest big city in the state and one of the safest big cities in the entire country. And that's part of the conversation we're having now. How do we make sure that we're just not resting on our laurels, but we're adapting and changing so as to make sure that everybody in our city feels safe, both those that historically have and then those that historically have not. How do we move our community as a whole forward? And those are the conversations. But anyhow, it's an interesting graph I came across today, and I thought that I would share. So everybody try to stay warm this week. And even though it's cold, it's important that everybody gets out to vote. According to the Associated Press, Texans already have cast as many early votes in this presidential election, with even 5 days left, cast as many early votes as we cast in all of early vote for 2016. And if you look at total vote, we have already cast 80% of the total number of votes that we cast in 2016. So we have a lot of momentum. We need people to keep voting, even if it's cold this week. Make sure that you vote. And let's make this a year when we vote in such great numbers that there can't even be a suggestion of a mistake. I keep hearing folks talking about whether or not you're creating doubt as to whether or not your vote will count. Your vote will count. The more people tell you your vote won't count should build your resolve to vote, because the more you hear that, the more you know that it's important that you actually do vote and get your vote counted. We hear rumors and fears of voter intimidation and things happening at the polls. I've seen no evidence of that actually happening in our town. While we will be prepared for anything that could arise, I just want everybody to know that my expectation at this point is that this election is going to look a lot like elections in the past. We just need everybody to actually vote. As of Sunday night, half the registered voters, and remember we had a record number of registered voters with 97% registering, half of them have already voted. And we still have another a week here of early voting. Ends on Friday, so you have Tuesday, Wednesday, Thursday, Friday to vote. And on the 28th, 29th, and 30th, the last 3 days of this week, Wednesday, Thursday, and Friday, there are going to be a few mega centers that are not only open 7 a.m. to 7 p.m., but stay open to 9 p.m. So you might want to try to find those mega centers if you're a late night voter on the last 3 nights and want to vote after 7. If you've already voted, I urge you to call 2 of your friends and that haven't voted yet. Ask them what their voting plan is. Find out when they're going to vote. When people commit to voting at a certain time, it increases the chances that they will actually vote. Please make sure you vote, even if it's cold. Go all the way down to the bottom of the ballot. No lever to pull this time to vote for one party or the other. Vote for president and vice president at the top. Go all the way down to propositions A and B, and make sure you vote on those 2. That's all we have for tonight. You all take care. Good night, and be safe.